All right, let's go through this case together. Starting with the bone scan findings, there is intense symmetric uptake of the tracer in the thoracolumbo-sacral vertebrae, bilateral ribs, clavicles, pelvis, and scapulae. What's also notable is the reduced renal uptake of the tracer, which immediately draws my attention as it suggests an important pattern. This pattern of findings is consistent with what we call a superscan. A superscan is characterized by diffusely increased osteoblastic activity throughout the skeleton and reduced or absent renal visualization. The intense bone uptake indicates widespread osteoblastic activity, while the lack of renal uptake reflects minimal tracer clearance through the kidneys due to extensive skeletal involvement. Now let's consider the possible causes. The most common cause of a superscan is diffuse osteoblastic metastasis, typically from primary malignancies like prostate or breast cancer. Other cancers, such as transitional cell carcinoma, TCC, and lymphoma, can also cause this pattern. Beyond malignancies, metabolic bone disorders like renal osteodystrophy or hyperparathyroidism could present similarly. Other less common causes include myelofibrosis and widespread Paget's disease. In terms of next steps, the immediate priority is to review the patient's medical records and imaging history. If the patient has a known primary malignancy, these findings likely represent skeletal metastases, and the case should be urgently discussed in a multidisciplinary tumor board for restaging and management. If there's no prior history of malignancy, further testing is needed to identify potential causes. This includes biochemical tests like serum calcium, phosphate, and parathyroid hormone levels to evaluate for metabolic bone disorders. From a radiological standpoint, reviewing prior plain radiographs or additional imaging studies is essential to characterize any abnormalities and correlate them with the bone scan findings. If this is the first presentation to the hospital, further diagnostic testing should be initiated, guided by the radiographic abnormalities and clinical context. To summarize, the bone scan findings are highly consistent with a superscan, most likely due to diffuse osteoblastic metastasis or a metabolic bone disorder. Further investigations are critical to pinpoint the underlying cause and guide appropriate management. If you find this case interesting and want to learn more about interpreting complex imaging studies, don't forget to subscribe to our Radiology Made Easy channel. Make sure to turn on notifications so you don't miss any updates, and good luck with your studies and exams.